difficult to introduce my inspiration. I must confess that all the things that I do, I always go to Dr. Thomas every 3 months in Geneva, sit with him, talk to him. If I look at his contributions to the world, he's among the most prominent public health figures in the world on his campaign against tobacco. I would just say that it was luck to meet with him and work with him in the World Economic Forum more than a decade and a half. We became friends. He's currently the chairman of the WHO Foundation, president UNESCO, president Swiss Red Cross, and wears many other hats. But a real inspiration for everyone, and it's over to Dr. Thomas Zeltner. Dr. Thomas, you're welcome.
Well, thank you so much, and I hope you can hear me, and if not, let me know.
Thomas, we can hear you.
Oh, that's lovely. I'm sitting actually here in Switzerland, and it was a kind of difficult at the beginning. Now I can hear you, and you can hear and see me. What a joy to be with you today, and congratulations for all who have organized this meeting. I think it is an extremely important issue, bringing patients to a tech-enabled platform, and in that way connect patients, their families with the healthcare sector. What I want to do in these very few minutes is actually to address three reflections, or share with you three reflections I think have to do with the topic you are addressing today. First, and that's really very general, what are really the objectives of a health system? What do we want to achieve with the health system? Secondly, what are the fundamental needs of patients in this system? And finally, is it true, and should it be true, that patients are in the center of the healthcare system or in the health system? So these are the three things, very challenging. I will not show any PowerPoints. It's always difficult to talk without PowerPoints these days, but it makes technology even more complicated. So what are the three fundamental objectives of the health system? Rahindra Gupta has already introduced me. I have been working for the Swiss government and at WHO for a long time. And at WHO, we had a long debate. What actually should a health system bring to the patients and to a country? And we, at the end, in 2000, after long debates, agreed on three fundamental objectives. The one seems very banal, is to improve health of the population and the patients. Here again, the key challenge, I think, is A, to measure that, and B, to get patient safety to the place it needs to be. Unfortunately, and we know it all, 1 out of 10 patients about leaves the hospital, leaves our care with an additional health problem, and that doesn't need to be. Much can be done to improve that, and patient involvement, patient safety has helped in that respect. Second goal, and that was not easy to achieve actually, and is not achieved worldwide, is that patients and their families are not only having a major problem with their health, but these days they also have financial problems when they seek help. And so the second goal WHO agreed on is that we all together, and member states and states, should actually make sure that we provide financial protection against the cost of ill health. That sounds non-realistic, but it is a fundamental objective. Be it that we have a government-run health system, be it that we have another system with health insurances. But in any case, we need to make sure that apart from the worries people have with their own health, they should not have to worry about the financial consequences of that. We know that bankruptcy in the US, the most frequent cause is actually ill health. And the third goal WHO defined is that we should respond to people's, patients' expectation. In that respect, one of the expectation everyone has is dignity, is privacy, and we need to make sure that we can actually achieve that too. In all these three areas, I think that the tech-enabled platforms can do a lot and can bring a lot. And we need to work with the patients to see how do we achieve that. Let me move to the second issue, which is what are really the needs of patients and what are their fundamental needs? Interestingly enough, I think we in health do not look too carefully into the research on human needs. And there is in psychology, and psychologists are much better in this, is a hierarchy of needs of human beings. And the hierarchies have actually been described in a kind of a pyramid where at the basis are the basic needs, and at the top are the needs that hopefully we can achieve. The basic needs, no surprise, are physiological needs. We need oxygen, we need food, we need water, we need warmth, we need rest, etc. All these things. And as long as these needs are not covered, actually, we as human beings tend to concentrate on them and not go to a next step. So our patients, of course, they expect when they come to the hospital that they get into the warm, that they can rest, that they find food and water, etc. In order to get then to the second level of our patients' need, which is actually safety needs. We all want to be safe. We all want to be protected. And in that respect, health and healthcare has become a difficult area because we can do a lot. But safety in that very highly technical and complicated world is a problem, and we have to work on safety. The third level of needs is actually what we call relationships, friends. Even our patients, they need to feel that they are loved, that they are in good hands, that they are interacting with people who understand them. And in that respect, it is also a patient need to be in an environment where this feeling of not being lost is still there. The next higher level, and I don't think that is possible all the time, is actually to keep self-esteem. That we are giving patients the option, the possibility to remain happy and confident about themselves. And that even with major diseases, that they feel, I have a meaning in my life, I have a self-esteem. And finally, at the top level, if you want, is actually what we call self-actualization, which is that patients or people are able to still keep what they feel is the most important thing for me in life. I think patients, and we all should more think about these different levels of needs, from physiological needs over safety needs to needs of being part of a community, of a family, of friends, to keep our self-esteem, and finally, hopefully, find a meaning in your life, whatever your health system or health status is. So that's the second point I wanted to address. And again, here I think quite a bit can also be improved by technology, like the question of how can we actually keep connected to the family? How can we keep connected when at home with a medical doctor, etc.? And in that respect, I think technology is something that could bring us much more closer together. Let me jump to the last issue I wanted to address quickly here. We all say and have been saying that the patients and the families, let me add that, should be at the center of health and healthcare. A good friend of mine, Don Berwick, who is the head of healthcare improvement in the US, actually, after long reflections, said, I'm not sure whether that's true. Should not be the core of health and healthcare be a relationship. The relationship between someone who is suffering and seeking help, and someone who is doing the best to bring help and relief to that person. And in that respect, the core of healthcare is actually a relationship. And he says, the best word I find for that relationship is actually love. If there is love between the person who needs help and the person who is able to bring help, then we're probably in a healthcare system where things are in the right order. Again, here, I think technology can bring quite a bit. If you talk to patients, what they complain is that doctors never have time. They don't talk to them enough. And you know these data from that normally doctors interrupt patients after 45 seconds. And I think there, if we can, with technology, give enough time to doctors to spend time with patients, we do a lot. The other thing is, how can we improve privacy, intimacy of this relationship, that we are able to bring doctors and patients together without anyone else listening, without being disturbed, etc. So this doctor-patient relationship, which builds on trust, knowledge, and loyalty, are probably things we need to look into much more carefully. So these are these three reflections I wanted to share with you. Let us all work on this question: how can patients be more involved, and to what extent can actually technology bring us closer together under all these three perspectives? Thank you so much.
Thank you, Dr. Thomas, for clearly articulating, which you always are very passionate about, that healthcare is not transactional. It is a relationship between care provider and care seeker. and which should reflect love and self-esteem in the entire relationship, and technology can be a great enabler. We could ask for a better message, given that we are talking of patients, and as always, we look up to you for your directions to the healthcare sector globally, and we are very fortunate that you took out time, given that we are one day before the World Health Day. We know how busy you would be, but thank you so much for taking out time. I look forward to seeing you next month.
Thank you so much, and have a very good end of your meeting. And hopefully one day I will be able to make it to Delhi. Thank you.
Thank you.